Well, Talbert House is a multi-service agency here in Southwest Ohio. We have about 40 locations, about 900 employees. We run a series of programs that focus on prevention, assessment, treatment, and reintegration, primarily dealing with substance abuse, mental health, homelessness, courts and corrections, housing kind of issues. Our mission is to solve tough social problems by providing, helping people with their personal recovery and growth and their social development. And so in order to do that, we deliver this array of services: outpatient, hotline, residential, day programming, a whole range of things. We have about 900 residential beds, about a series of outpatient and day offices around the community. When we first started to consider the affiliate model, or what do we need to be successful really, how are our clients going to succeed, how are our staff going to succeed, how is Talbert House going to be successful, we actually brought in a consultant from Pennsylvania, one by Monica Oss. And Monica talked about the size of an organization and the ability to contract and do all the things that were going to be necessary in the new environment. And so that got everybody thinking about, geez, where are we going to be, what are we going to do? So for Talbert House, we knew we needed a comprehensive array of services, and the affiliates helped us do that. We needed more talent, both clinically and management talent, than we had. And we knew we needed to have a larger scope so that we could push our costs down, especially administrative costs. When we started to talk to CORE in '97, it became apparent that they were the prime provider of outpatient adult mental health care. And that was something that we didn't have a lot of, and we could use that expertise to serve not just our clients, but the rest of the community. In addition, back in the beginning, when the Mental Health Act was passed, the Kennedy and Johnson administrations, in our community there were 5 mental health centers, catchment areas. And CORE made up 2 of those catchment areas. So we were picking up a very big geographic spread to the western side of our community. When it came time to working with Center for Children and Families, they were known as the children's agency in town, but they were also the catchment area for the east side of town, the far east side of town. So once again, we picked up the clinical talent, we picked up more children's services, and we became one of the dominant children's service providers in the community as well. And when NORCEN came on, they had a little bit of everything. They had some children's services, some specialty programs for sexual abuse, as well as some outpatient services. So, and they were one of the catchment areas too on the north central side of town. So we really kind of filled ourselves out geographically, clinically, and financially. After a while, we thought operating 3 independent, primarily mental health organizations really was pretty inefficient. And we decided to merge the 3 of them into one. And we thought they'd be stronger as one organization than as 3. The boards all saw the wisdom of that. Again, the board members from the 3 organizations helped plan this out. They actually formed entirely the board of the new organization, Centerpoint Health. And in 2008, we brought them all together under one name. And that worked pretty well. In fact, the Centerpoint results, our payer source here, measures outcomes. And for the first 3 years of Centerpoint, Centerpoint's outcomes were #1 in our community of all the mental health services. So we know that we are doing the job clinically. As the economy worsened, their cash flow got to be more concerning. The receivable number got bigger. Talbert House had to keep floating more and more loans, we were prepaying all their benefits and everything else. And it seemed like when we had a 7-figure obligation from Centerpoint, we needed to talk and see what we needed to do to change that. And so a decision was made to go from 3 affiliates to 1 affiliate to eventually merging Centerpoint into Talbert House, primarily because of financial reasons. When you start to talk about affiliations and mergers and acquisitions and all that, it always comes down to the relationship with the key principals. And so when we started these, the most important thing was dealing one-on-one with the other CEO, the other exec, and saying, what do you think? What's your vision for your organization? And to try to see if we get some common ground. So in each case, what we did was we developed a new mission statement for the discussions. What do we want to accomplish? And every time we would get a little bit sidetracked, we go back and take a look at that. We didn't go out and hire consultants. We did it ourselves. We used board members as consultants for their legal expertise or their accounting expertise or whatever. And we took it as an opportunistic approach. That being that we weren't going to make a lot of decisions on the front end about staffing and everything else. We're going to see how that went. And as a matter of fact, we didn't lay off anybody in any of these mergers and acquisitions. Not one person ever got laid off. At the same time we merged Centerpoint in, we decided that it was a good time to kind of realign all of our services into service lines. Because Centerpoint was kind of its own service line, we needed to get it all aligned. And we created a vice president position over the 5 service lines, and then reorganized the staff below that. And the fly in the ointment is we made a lot of personnel changes internally, moving people around, which is part of our culture. We like to have people move around in their assignments. And we probably made too many when we did that. So while the merger itself went well, the merger on top of the realignment was a lot of change for the organization to absorb in a very quick time. Well, if you're a large organization, you're going to get in the business of creating an affiliation model or acquisitions or mergers or whatever you would call it, or whichever of those you pursue, because they are different. I think one of the first things you have to do is realize you're dealing with people here and that egos have to be checked, and you need to make sure you're dealing with people on a very real basis. And if you're the acquirer, it's a different position than if you're being acquired or if you're being merged into an organization, and you need to keep that in mind. And so treating people with respect and consideration and listening to them and trying to find out what they need out of the deal is extremely important. A second lesson would be you can't communicate too much. At times we were very successful at that, at other times we weren't. Of course, as a CEO, I knew most of what was going on, so sometimes you don't think about having to communicate all those things out to everybody else, and most of my direct reports knew what was going on. But the organization as a whole didn't. And the other thing is the organization as a whole and the affiliate organization are anxious about this. They're wondering, well, what's this mean for me? How am I going to survive? And you know, the key question for almost everybody for everything is, what about me? And so you have to take care of that, what about me? The other thing is, I think, the due diligence. You know, there's lots of due diligence to occur here. Looking at financials, looking at insurance, looking at, you know, are there any liabilities or risk issues out there that you're not aware of? Looking at the assets, you know, are there assets involved? How would they transfer or how wouldn't they? A lot of smaller organizations, unfortunately, are in a position of not being asset rich, and that's one of the reasons they come to the table, is they want to ensure their survival. And the bottom line to all this is folks want their mission to succeed. And the organizations that are affiliated need to be assured that their missions are going to live on beyond what they have in the past. As I look back over the years, over this last 15 or 16 years, from the start of our process till today, I think things have changed pretty dramatically for us. We're about triple in size. We have our net assets have gone up threefold as well, not just our yearly financials, but our net assets, which is of course very important because you have to be strong. The other thing is that our IT and backroom offices have gotten better. We focus more on outcomes than we ever focused before. So with these kind of mergers and affiliations and deals, there aren't the typical assets you have in a for-profit merger. The biggest asset is the talent, and so you want to maintain that talent. You want to keep them on board, committed, and you want to make sure that mission continues. So when I think about it in retrospect, I think one of the biggest things we gained out of it was the talent from the organizations, and that's made a huge difference in our organization.